Joining us now is Dr. Georgette De Jesus, a psychiatrist, MD, so physician and psychiatrist. She is with South Florida Integrative Medicine, and she is here to talk about what we're all talking about, COVID, how it's affecting us, how it's affecting our kids, and what we should do and what we should know. So let's get it started. What are the new variants of COVID in our area, doctor, and what symptoms should we look for?
So the variant that seems to be the prevalent right now in the whole nation, not just in our area, seems to be the Delta variant, right? So we're looking for cough, chills, fever, abdominal symptoms like nausea, diarrhea, body aches, just general malaise, sometimes a sore throat, runny nose. Those can all be symptoms of this variant.
So what's the best way to protect our kids and ourselves and, protect ourselves and prepare ourselves, really?
So it's simple. So you can only control you and what you do. So get vaccinated and wear masks, right? If you have little kids, they're not going to be able to get vaccinated just yet. So make sure that they're always wearing a mask when they're indoors, including at school.
Okay. And for those patients who contracted COVID and have recovered, are psychiatrists seeing any kind of ongoing cognitive impacts?
Yeah, so most of my patients who have recovered have done okay, but have some lingering sort of mental fog, fatigue, sometimes some memory issues, or just like difficulty paying attention as they used to, right? So that's what I'm seeing mostly right now.
I feel like I maybe had COVID and I didn't know it then because it happens to me all the time. Okay, we hear about the concept of also pandemic fatigue in the media. So as a psychiatrist, what are you hearing from your patients?
So what I'm hearing now is different from what I was hearing maybe a few weeks back. So a few weeks back, I think everybody was, in the middle of summer, wanting to get through their regular lives, happy to not have to wear a mask as much anymore and have more freedom. Now I'm hearing more people be concerned because a lot of them have had close ones who have had the new COVID variant, right? So I'm seeing most people now take it more seriously, starting to wear a mask again. So that's encouraging, right? Because hopefully that will protect us all.
I'm going to go rogue here and just go with a question I wasn't planning, but how do you handle, there's a lot of people who are pro-mask and then there are people who are anti-mask. I don't need to have, you don't have to tell me your opinion, but how do you handle a differing opinion without getting into too many politics?
Yeah, so I don't think it's about politics. I think it's about science, right? So as a doctor, we know both the CDC, the AMA, which is the American Medical Association, and the American Academy of Pediatrics recommend using a mask indoors. And it's based on several scientific studies that show that there is protection with masks, right? So again, it's not politics, it's science. So it's important to keep that in mind, right? We're just trying to protect you.
All right, thank you for that, doctor. And what are your top two self-care strategies that you recommend to your patients?
So get enough sleep and get enough exercise, right? Because both these things are going to help you manage your levels of stress and are also going to help you improve your immunity. There is a functional medicine doctor, Dr. Mark Heyman, who says that if exercise were in a pill, that would be the biggest medication blockbuster of all time, because it's true. Exercise just does so much for you. So make sure, again, that you sleep enough and that you get moving.
Okay, sleep, exercise, wear a mask. There you go. Dr. Georgette De Jesus, a psychiatrist with South Florida Integrative Medicine. Thank you so much for your time.
Thank you.